The Ontario Medical Association would tell you that approximately the average proportion of service right now in a fee-for-service model is one doctor for 1,300 patients. What we have before us in the Copeman Clinic proposal is that for each clinic open, the one in London, proposed, the one in Toronto, proposed, the one in Ottawa, proposed, for every one of those clinics with 9 doctors, 4,500 patients will be left behind orphaned in the public healthcare system. In an environment where one of the most serious challenges we face is a shortage of family physicians, and we have taken considerable action to seek to address that. A 23% expansion in the size of our medical schools, 200 spots for our foreign trained doctors and family health teams as a model to deliver broader care. In an environment where we all acknowledge that there are too few physicians, I really think it's incumbent upon those who are proponents for a two-tier style clinic like the Copeman Clinic to explain to us how it's appropriate to leave behind, for every doctor that serves in a Copeman model, 800 patients orphaned in the public health care system. I don't believe that that is working towards the access challenge that we're all experiencing. We have a fundamental belief that the improvements that people seek are more quickly delivered in the context of a public health care system, because the clinicians on the front line are already involved in the innovations today, seeking to make delivery on improved performance for patients today and tomorrow. This is a discussion of the eggheads, and then it goes on to the lawyers, and it's a 5 or a 10-year phrase. Everyone talks about Chihuly. This case started in 1996. I'm not interested in a ministry that has to employ more lawyers. I'm very interested in a healthcare system that employs more healthcare providers, and that has been our focus. On the innovation front, family health teams. Next week with the Premier, we will announce the final 50 of the 150 that we promised. They're coming to life in communities all across Ontario in very different ways, addressing the underlying population health statistics, which is appropriate for the communities where they're operating. And as they come to full life, they will provide an extended array of care to 2.5 million Ontarians. And I think that's something that we should celebrate as an innovation. Wait times. We've increased access to MRIs by 42%, and in each of the 5 areas, we're seeing tremendous progress in reduction of wait times. Those are not obviously the only wait time challenges, but the key point here is that by forcing accountability into the public healthcare system and by determining exactly what we want and getting people to sign on the bottom line for the dollars, they're delivering better results than they, in many cases, have ever imagined. And those business principles, which are now being adopted, and frankly were not there. Example, 29% of Ontario hospitals were not starting their surgeries at the scheduled time on a given day. No wonder then that Mrs. Jones' elective knee or hip surgery was falling off the table at the end of the day. For her to wait for another day, now they're starting on time. And those business principles, which seem very, very simple, attached to an accountability agenda, benefit across the breadth of the wait time agenda. They are practices which are revolutionizing the way that hospitals do their work, and they're going to have an impact in areas well beyond those 5 that we've spoken about. It's been well put by Dr. Guyette. We cannot ignore the competitive reality here. Look at the circumstances with respect to Delphi, the agreements that the Big Three have made with the United Auto Workers in the United States, to understand that at the very same time that industry in the United States is being put at a competitive disadvantage because of their healthcare costs, that we would seek to put pressure on ours in the very same, at the very same time. We've secured in Ontario $6 billion worth of auto sector investment. We have secured that in some significant measure because of the greater predictability around the costs that the private sector would have to pay for its employees. And I ask all of you, some of you are here as interested individuals, and some of you also have decisions about what's in your private health care plan. And to the point about the proportion of GDP which we wish to commit to the exercise of health care, I ask all of you, are you going to go back to your office and write the memo that says, associated with our desire to expand private care, we're going to offer that broader array of insurance product to all of our employees? And what will be the circumstances that occur then in terms of your competitive advantage, especially if you're practicing and operating in a global marketplace, which I believe is the trend. We spoke about the increases in healthcare. When our government came to office, we were experiencing something like an annual increase of 9% in healthcare spending. For 2 years running, it's 6%. This year, 5.8%. And this is being achieved at the very same time when we can demonstrate increased productivity in healthcare. For once, because of the accountability agenda, we can demonstrate that a dollar put into healthcare is producing a dollar of return in the form of productivity, which means more access and more services for the people of the province of Ontario. Of course, we have more work to do. I am not done yet, nor is our government. But the reality is that I think that we owe it to ourselves, that we do a disservice to the patients, the taxpayers of the province of Ontario, if we seek to pretend that there is not the capacity for innovation in the context of the public healthcare system. Even Alberta is demonstrating that, notwithstanding the bluster and noise that comes from their premier. And accordingly, I think it's very, very crucial for those of us that are interested in this debate not to participate in a fake debate. The reality is that two-tier is a threat to the underlying fabric of our society. In an environment where there are too few physicians, then I lay the challenge down to the Copeman folks to explain to us why we should accept a model that is one for those privileged enough to be able to pay hundreds of dollars a month or thousands of dollars a year for an additional array of services. Every doctor stripped away from service in the public healthcare system to go and see a smaller proportion of patients in a more elite and one that is accessible only to those people with a deeper wallet. The circumstances are clear. In an environment where there are already too few doctors, the reality is that for every Copeman clinic that opens, the proposed clinic in London, the proposed clinic in Toronto, the proposed clinic in Ottawa, 4,500 orphaned patients, additional orphaned patients, left behind in the public healthcare system. And accordingly, I think you'll have a very firm grasp of why the government of Ontario is not prepared to stand by and watch that happen. Thank you.